back, South Georgia. Welcome back. Thank you so much for sticking around. Well, if you didn't know, May is Mental Health Awareness Month, and today we're talking with Phoebe's behavioral health psychiatrist, Dr. Maria Jasinskis, to talk about the importance of taking care of our mental well-being and breaking the stigma. So welcome to Town and Country, Doctor. How are you doing today?
I'm great. Thank you for having me.
Good, good, good. Now, I just want to start off with what are some of the, or how common are mental health issues in both adults and children?
Well, statistics show that 1 in 5 adults have serious mental illness, and 1 in 6 children and young adults are suffering from mental illness. Mostly anxiety and depression.
Wow.
Is what we see.
Okay. In children as well?
Children, yes.
Wow. Okay. So why is taking care of our mental health just as important as our physical?
They're so close together. I mean, your brain is like the center of your body. It's kind of like an air traffic control center.
Wow.
So you really can't separate it.
Yeah.
And if you're depressed, you're going to have chronic illnesses. If you have chronic illnesses, you're going to end up with depression if you don't have good coping mechanisms.
Wow. Now, you mentioned to me that you've been in this role for about 25 years. So I want to get a little personal with you a little bit. So how has your own life experiences shaped your desire and want to help others with mental health?
I didn't know you were going to ask that, but I did bring something to help me explain it.
Oh.
This is an ANT, and it stands for automatic negative thoughts.
Oh, wow.
When you fill your brain with automatic negative thoughts, you don't really have time for the positive stuff. And if you center your concentration on something negative, it's going to bring down your immune system. There's actually something called a natural killer cascade that gets offset. If you spend 20 minutes or more focusing on the negative,
Really?
it can decrease your immune response to infections, and it can increase inflammation, causing further disruption.
Wow. So how can someone, I mean, if, as you know, life is just hard for a lot of us, but how can someone kind of snap out of the negative thoughts?
Well, I brought another friend.
Oh, we got more friends.
My little butterfly.
I love
So
it.
whenever you get a negative thought, change it to something positive. Try to
Yeah.
catch yourself, and if you can train your brain, it's called cognitive behavioral therapy. It's like seeing a glass half full or half empty, and the decision and the choice is really in you.
Yeah.
So you don't have to succumb to all the negativity around you. If you can find something good, something positive, and train your brain not to focus on the negative,
Yeah.
and smile.
Yeah.
When you smile, your face uses over 40 muscles that actually trigger your brain to think your body's doing well.
Wow.
And the opposite happens if you're frowning all day. That's only 7 muscles. And if you stay on that negative thought process for more than 20 minutes, you can set off that negative cascade. So
Yeah.
smile.
So what I'm hearing is we're in control. You know, we have to just think positive thoughts, and we'll have positive outcomes. So
Yeah.
I love that. I love that how you put that together with your friends. It's cute. So what are some signs we should look for in loved ones that may indicate they are depressed or suicidal?
Well, sometimes you can't tell when someone is depressed, but some signals could be disturbance in sleep or interest or decreased energy or concentration or appetite, changes in weight, sleep disturbance. And you know, some people can play it off better than others, and just check in on each other.
Yeah.
We're all in this world together, and we're
yeah.
going through the same stressors, and you'd be surprised if you just ask. Some people don't feel comfortable asking, and in that case, just lend an ear to hear.
Yeah, absolutely. I totally agree. What services are available at Phoebe, and how effective can they be?
And at Phoebe, we offer outpatient services. We also offer inpatient services, and there's actually groups through our inpatient intensive program. You can sign up and call and get put on the list. The medication is quite effective, but medication is only 30%. The patient has to do the heavy lifting through trying to train your brain to think differently, and that's why therapy is so important.
Yeah.
You can't do one without the other.
Yeah.
Healthy lifestyle changes, if you can engage in actual therapy, is something good that you can do for yourself. It's an investment that you make for you, for your long run, and in your positive outcome as well.
Absolutely.
Just 20 minutes a day
Yeah.
can set the brain to start producing natural endorphins.
And I love that you mentioned therapy because if someone's watching, if they need therapy or if they need help, how can they get in touch with you all?
call us at 229-312-7001.
Okay.
And if it's after hours, we actually have a 24/7 call line that's being manned, and it's connected to the inpatient unit.
Wow.
So it's 229-312-7000.
Perfect. Thank you so much.
You're
Thank
welcome.
you. And I love the friends that you brought.
And thank you for having me.
Of course. And we'll have all this information posted on our website at WAOB.com. But don't go away just yet. Coming up.